in general, when we're talking about the U.S. healthcare system, it really boils down to the fact of why it is such a mess. And universal healthcare is really an interesting kind of insurgent new idea. It's an old idea, but it failed with the Great Society. It failed under FDR. That really the idea of socialized medicine has never really been popular with Americans, with the sense of you're forcing me to do something I don't want to, so therefore I'm going to vote against you. But it seems that as Bernie Sanders kind of electrified the Democratic Party in 2016, that it gained traction on the left. And it is a very interesting idea with where revenue will come from, how much revenue will save. But I think the main issue they'll need to tackle is, rather than who pays the bill, why are the bills themselves so high? Just for the reason that the healthcare system, with regards to hospitals, have these secret little ledgers where they jack up the prices to astronomical quantities. I think it's something like $80 for one aspirin was the price at a certain hospital. So universal health care is a great idea for how we should foot the bill. We, again, should be asking, why is it so high in the first place?
This isn't a class on cost accounting, so I can explain to you at some point why an aspirin would cost $80 if I were to take a multi-billion-dollar institution and divide the fixed expense by each prescription or each hospital room or whatever. But I don't think that's what we're trying to accomplish today. I think what we're trying to accomplish today is understand where we are in terms of healthcare, where we might go in terms of healthcare, and why is it, you're asking the question, why is it so expensive? And so let's start with that. I think we can both agree from the statistics that healthcare is more expensive in the United States than any other country, at least Western democratic country where healthcare is a right and not a privilege. So why is that? And it's that way for a number of different reasons, but among them, and most important, what separates us from other countries is that we have multiple profit centers here.
Right.
Okay. So when you're running your dental clinic and I'm running my eye clinic and Jack is running his cardio clinic and Sean is running a hospital, etc., we end up with all sorts of different profit centers where you're going to make your profit, I'm going to make mine, everybody is going to make theirs, and the people who end up getting gouged are the consumers. So why are the consumers getting gouged? In large part because they're not footing the bill. They don't see the expense. I mean, even if you have a very high copay, you're not seeing the expense in terms of anything that occurs beyond the copay. So there's a problem both in terms of how we structure the delivery of health service on a for-profit basis with individual profit centers, rather than in other countries where people are working for the state or for the government in healthcare. That's part of it. Part of it is that insurance covers most of the bill, and the insured don't particularly care how much the bill is.
Right.
They only care about their copay. So if my copay is $100 and the bill ends up being $47,000 because I happen to select that health provider as opposed to that health provider who would have charged me $28,000, I'm still paying the $100. So what do I care about that or that? The costs aren't being borne in a rational way, and the expenses are being incurred on behalf of profit-making institutions that don't exist in other countries. Right. Purely by way of example, and then you pick up. Purely by way of example, and you may have heard this story once. When I developed pneumonia in Turkey, I went to a health clinic. Well, okay. And I went there on day one. I was diagnosed with pneumonia. I had an x-ray taken of me. I saw a doctor. In 1 hour time, I went in, I was treated, I left, and I was charged $65 or whatever it was. And I was given a prescription that I then needed to fill for the antibiotics that took care of my pneumonia, and that was another however much, $20.
Right.
That was the expense. That wasn't an insured amount above which some person behind the screen was paying
Right.
large amounts. That was the expense that I was charged that anybody else under my circumstances would have been charged. I then went back for my follow-up visit 4 days later because, after all, take these for 4
Right.
days and then see me. So we had to cancel the rest of the trip to Turkey, so I stayed in bed in Istanbul while I was recovering from my pneumonia. And then I went back for a follow-up visit, went in, saw the doc, went out, everything's good, you're excused. Okay, how much do I owe you? Oh, owe me? That was all part of the $65 you paid the first day. So the world is so different in every other country on the planet because taxes are already going to pay for the health coverage, and then whatever you need to bear, and if it's $65 there and $40 at a different health clinic, well, I could make the decision to pay the $40 instead of the $65. Yeah. So what have I done to trigger a thought on your part?
Well, so with regards to the unfathomable thought of paying $60 to see a doctor in the United States, which would be fantastic if that was the possibility. But with regards to the structural quality of the American system versus the structural quality of the Turkish system, or for example the German system where the employer pays, or the Canadian system where it is truly universal, at what point did the American system truly begin to collapse on itself? Has it always been this bad? Because when you do take a look at other countries, we spend astronomically more for astronomically less.
Exactly so. I mean, I agree with you that we're paying more for less. That's not a very rational way of doing public policy. In the United States, of course, we have vested interests. We have all sorts of profit centers within medicine. We have all sorts of profit centers within insurance. We have all sorts of profit centers within the hospital system, all of them contributing toward lobbying efforts, electioneering efforts, in order to entrench the status quo. So, how did we get to the status quo? I'm not going to be able to give you a complete answer. What I can tell you is that back during the Truman administration and back during the Nixon administration, there was discussion of what to do with the healthcare system. And it was decided that it would be really useful, given how relatively inexpensive healthcare was at the time, certainly in the 40s and early 50s when Truman was in office, but even in the 70s, when Nixon, 60s and 70s when Nixon was in office. Healthcare was a very small part of our GDP relative to where it is now. So therefore, employment was at virtually full levels.
Right.
Why don't we give businesses an incentive to recover their employees by giving them a tax write-off? Under that circumstance, Americans who were already fully employed, effectively, could get their health insurance through their employer. They wouldn't have to pay taxes on the on the benefits that were being provided, and this would be a win-win for everybody. We provide health care in a tax-free way for the American people. What we didn't anticipate back in the 40s or back in the 70s was in part the extraordinary increase in healthcare expense. Now, there are all sorts of reasons for that. Let's put that aside. Right. We also didn't anticipate the shift in employment from somebody working for a job forever and a day and having an array of benefits that would be provided generally to him, but hypothetically to her, that would be sufficient to cover the family's needs, which was the case in the 40s and to a lesser extent, but still generally the case in the 60s and 70s. We didn't anticipate the shift from one person in the family working for the entire family to everybody in the family working, and everybody in the family working generally for a series of part-time employers without having the kind of long-term relationship. So what was designed in the 40s and continued in the 60s, 70s was designed with the best of intentions. It wasn't, these weren't cigar-smoking evil people with mustaches behind the scenes.
Nixon is debatable, but yes.
Oh, how can we stick it to the American? That didn't happen that way. It happened with the best of intentions, and then the system evolved in ways that didn't meet the current needs. So now we have a system that doesn't meet the current needs.
So in the sense that the American education system is set up to basically provide for a bunch of industrial workers in a world where you don't need a bunch of industrial workers, the American healthcare system is set up to provides for some sort of Leave It to Beaver-ish 1950s home model that no longer exists.
It gets even worse than that, because at some point after the 1940s, and I think even during the Nixon administration, I don't remember when the Supreme Court decision that guaranteed the ability to get emergency health care came out. But under the Due Process Clause, something you're familiar with, the government can't deprive you of life, liberty, or property without due process. Well, health care, it ends up on an emergency basis, fits either, depending on how you look at it, your life, your liberty, or your property.
Right.
And so the government can't take that from you without due process. Well, if you're on your deathbed and you get wheeled into an emergency room, the U.S. Supreme Court has concluded that that hospital needs to provide you with emergency care whether you can pay for it or not. Now what we have is a tax on the American people,
right,
arising from the fact that anybody can go to an emergency room and therefore cannot take care of themselves at the front end, get some, develop some emergency, or feign some emergency, one or the other, end up at the emergency clinic, and the hospital has to provide the service without being able to charge for it, or at least without being able to collect for it. So all these uninsured people have a bizarre incentive created by the system to go in this direction, where a rational system would provide health coverage for them before they got deathly ill and needed the expensive coverage over here. Rational people, theoretically, could look at this and say, well, that system, as well-intentioned as it was back then, is no longer working for us today, and we need to revise it. Unfortunately, what we have are either attacks on a series of entrenched interests, which are exceedingly well-financed, and therefore which are going to have a great deal of sway with Congress, or we have attacks that are seen as revolutionary on that system, which are going to cause a lot of Americans to get awfully, awfully skittish. So that's sort of where we are right now.
So at some point, you have to have a democratically elected official basically give up their ability to be reelected. Or if it could even pass, you have to, besides just shaking your fist on the table, I'm going to do this, actually pass historically incredibly unpopular legislation, slap the American people on the wrist, tell them to pay more taxes, which, as we can see in Jimmy Carter's crisis of confidence speech, telling Americans to do more with less never goes well.
It doesn't go well. We are not a people who are accustomed to paying high taxes for high government services.
Right.
When the Affordable Care Act was first promoted to the American people, it was actually promoted by the Heritage Foundation. You probably know this. It was a Heritage Foundation idea that everybody be responsible in some way for providing for their own coverage or for paying into a system that would then provide basic health care coverage for them. What President Obama did was try to roll out some Republican-generated or conservative-generated Heritage Foundation concept, which ended up being demagogued very successfully. If you think about success as meaning winning votes and winning elections.
Most definitely.
So I'm going to take this Republican-originated concept that Barack Obama then rolls out as universal health care and say, well, that's socialism.
Right.
Of course, the American Medical Association said, when I was about your age, back when Medicare was first put in play, that's socialism.
We also did that with public schools and public roads.
All of that is so. How dare you? And then eventually, during the debate over the Affordable Care Act, you have these Americans pounding the table and saying, keep your grubby government paws out of my Medicare. Keep your government paws out of my Medicare, which of course is a government-funded
institution,
service for the old and the disabled.
Right.
We will eventually, I suspect, end up diverting so much of our GDP toward healthcare that it will become even more of a crisis than it is now. And unfortunately, we'll be demagogued into doing something stupid, as opposed to doing something rational the way it's been done for decades now in Western Europe and in Japan and a bunch of other countries.
So what is the main difference between Western countries and Japan that allowed them to pass such things? I know, for example, Japan basically has a one-party system aided by a rather wonky electoral system under the Liberal Democratic Party, which chooses to be relatively moderate. But what is it about their democracies that allowed them to create this in the first place that we could not do until the ball got rolling?
I'm not certain that we couldn't have done it the way we did in the United States. It just so happens that back in the 40s, when this system that has ended up getting so perverse got started, and President Truman was given the choice, gee, how do I want the Democratic Congress to go on this? Do we want government-provided health care or a bunch of insurance companies? Well, he just happened to say, well, why don't we create this through an insurance mechanism, given the fact that we can create these tax incentives for businesses and for Americans, American workers who are receiving these health benefits and not paying taxes for them, isn't that the equivalent of a government structure? And in that way, I don't have to make these people into government employees. In Western Europe, as an example, where the cost of healthcare is so much lower and the GDP that's diverted into healthcare is so much less, where we have these docs who are educated by the state at very low expense, who work for the state and make a lot of money, but less money than American docs and American hospital executives. Part of the problem that you're going to run into when you try to reform this system today is that all of these docs that are their own profit center have invested so much money in their own education. It became so much easier back at the very beginning when we were first creating a national health service, as in the UK, where government provided health care, as in the rest of Western Europe, Turkey, Japan, Israel, a bunch of other countries. It would have been so easy to just say, gee, the cost of getting a medical education is so relatively inexpensive today. Why don't we just absorb that cost? Why don't we hire the docs? Why don't we run the hospitals? And I haven't researched this, but I suspect that if you go back in time, you would find that it certainly wasn't a malicious decision for Truman to go the direction he did. It ended up being a direction that has created enormous costs at this point. To now say to a doc who will have paid $300,000 for his or her own education, oh, by the way, now you're working for the state and we'll pay you this much money.
Please enjoy a nice pay cut.
Exactly so. That's going to be a problem.
Yes. In general, what I've gleaned today is that we, through a, at the time, rather rational decision, through the lovely rule of inertia with government, has kind of snowballed to the point where any attempt at reform would be horribly unpopular, would increase taxes and take a massive pay cut to people who are very happy to support the current political party, which would be doing that, namely either the Republican or Democratic Party, as professionals tend to like to go either way. And so in a sense, until we get to some sort of massive crisis point in which we will make some probably bad decision, or have to go this rather painful route through just the sheer massive collapse of the healthcare system, we will likely be enjoying our current system for time to come.
I think we probably will. I want to thank a couple of different groups. First of all, I really congratulate the student effort to put this thing together. I applaud you. I also am happy that I didn't know in advance what the subject was. I hope everybody understands that this was not pre-scripted and that this was just an impromptu discussion, and I apologize if I got my facts wrong at any given moment. I also want to thank the coffee maker.
Free coffee.
But I wish you all the best. I hope this experiment works for you, so best of luck.